Guided implant surgery with cone beam volumetric images provides a dental team with a method that allows precise 3D diagnostics and planning for the entire treatment process from the surgical phase through the prosthetic phase. I like this because it's an integrated and validated approach to a digital workflow. It's allowing your team to have a simplified digital workflow for the dental practice that allows the software, hardware, and materials to interconnect efficiently and reliably. This is where things become challenging is when you have one software from one company, a printer from the other, and then you're using a different surgical kit. When everything talks, it's a streamlined approach. And then if there's a headache, you only have one team to troubleshoot. So this becomes critical, in my opinion. Okay. I like this system because this system, in my opinion, is meant for a dental office that has a efficient dental assistant that understands how to print these, wash it, and then cure it in an efficient manner. But it is a very automated system, and it has the printer, which is your 3D Max. Then you have the wash, which you have to clean and prepare after it's printed, which is the 3 to wash, and then you have to cure it, which is the 3 to cure. Okay. Well, I like the printer. It's ultra compact, which becomes important when you look at the size of a printer. And if you're thinking of purchasing a printer for your practice, you ultimately have to look at the footprint this is going to take in your lab, your office printing area. But you have to figure out where you're going to place this in order to make it a user-friendly system. Okay. Uses force feedback technology, prints extremely fast. Another important thing, when you're choosing printers, you need to know the print time. Is it going to take a surgical guide 4 minutes to print, or is it going to take 40 minutes? Okay. That's going to affect how many you could print in the day. The big question I get when we're doing guided surgery in the posterior is, do we flap or not? A few weeks ago, I had one of the designers of the software with us and the surgical guide system. And the first thing he asked me is, how often do I flap and when do I decide? And we were working on number 31. If there's adequate keratinized tissue that give me a good margin of 2 to 3 millimeters around my punch, I will typically punch. If I can't get adequate keratinized tissue circumferentially around that punch, then I will flap. Okay. Um, if I feel I have to visualize the underlying bone, we did grafting. I'm concerned about um, the density of the bone, evaluating it. Maybe we have to modify and do some additional grafting. Then I will always flap. And I modify my incision and the surgical guide design slightly if I plan the flap. Okay. Disadvantages of flapless surgery, it's always my inability to assess the bone. Okay. I also do worry about heat. I've not seen it affect anything, but we use copious irrigation when we're drilling, and we drill at the appropriate drilling speeds. When we are flapping, in order to minimize flap retraction and drilling through your soft tissue. So I will typically go lingual or palatal to my um, incision where I plan, then I can retract that flap with our surgical guide. So instead of going mid-crestal, I will typically be more buccal or more lingual, still maintaining a keratinized tissue margin. Okay? I want full release, okay, in order to make sure that I can get it out of my way when I'm doing our drilling. That becomes critical because I don't want to have too many hands in my surgical field blocking my vision. After that, you need to verify the seating of the surgical guide. It has to be fully seated. Typically, I prefer to put a window so that I can see that it's seated. I prefer full arch printed tooth supported guides because it gives me a finger stop on both sides when I'm drilling to make sure it's seated. I typically don't like just a quadrant CT surgical guide. I find those hard to secure, and I find them tend to rock on me. Okay. After that, you're going to follow the drilling sequence for the surgical guide system that you are using. You don't invent your own surgical guide drilling protocol. You follow the drilling sequence in a graduated manner to the specific size that you are planned for that implant.